Guys, Dr. Christy Gutfeld is back for Mental Health Monday, and we are discussing alcohol-related health problems rising among women because April is National Alcohol Awareness Month. So welcome back, Doctor. It is so good to see you, as always.
Great to see you, too.
You are a gem, and I love talking to you because you always have very, very interesting, cool things to tell me, and I always learn a lot. So April is National Alcohol Awareness Month that we just said, and so what new research has come out about alcoholism in the past few years?
Well, I'll tell you, it's on the rise, especially for women. 30% increase in deaths from 2017 to 2021.
Wow.
So 2021. So we're really concerned.
Yeah.
And honestly, the pandemic has really exacerbated this trend.
Why?
Well, I'll tell you, especially for women, what we found is that they were so stressed out, who wasn't during the pandemic, but they had most of the brunt of taking care of the children, managing and juggling the work situations and so on. And so they tended to pick up 25%, as a matter of fact, of Americans began to drink excessively during the pandemic.
Kind of like self-medicating, right?
Exactly.
Yeah.
But the trend continues.
Yeah, because it's terrible. I mean, I lost my mom to alcoholism. It's a wild ride. Like it's terrifying, actually.
It really is. It's a disease, and it's a fatal disease if there's not intervention.
Absolutely. All right, so, why are women more impacted by these issues than men? We kind of covered that with the COVID deal, but why is it persisting now that we've gotten back out of the whole pandemic and stuff?
Well, we find that women are waiting a little longer than usual than our past generations to get married, to have children.
Right.
So they're right in that high-risk drinking age, if you will.
Okay.
So they're partying, they don't have the responsibilities of a family, and
something grounding them, so to speak.
Exactly, and so they're getting hooked. They move into that alcoholic phase and continue with their drinking, and it's causing serious health conditions.
Yeah, so for those who don't know, what kind of health problems does severe alcoholism cause?
Right. Well, we're finding that it greatly contributes to heart disease, certainly cirrhosis of the liver, which is the damage of the liver due to scar tissue with the excessive drinking, pancreatitis with the stomach lining that it affects. So lots of health conditions, very serious health conditions. Yeah,
very serious conditions, yeah.
Indeed.
Like watching my mom go through the ascites and all these other things. I mean, it's terrifying. It's awful. I don't wish that on anybody. So what advice do you have for those worried that they or someone they love might be dealing with an alcohol or substance use disorder?
Well, be very non-judgmental when you're approaching your loved one. This is a disease. It's not a moral failing.
Nope.
It comes from genetics and other factors, so we need to treat it like a disease. We need to offer support, offer to take that individual to AA, NA, treatment, and also reach out to us at LSF Health Systems. We have a 24/7 access to care line manned by our clinicians 24/7, as I said, 1-877-229-9098. We can connect you with detox centers, residential inpatient treatment facilities, outpatient, whatever you need in the disease process that you're experiencing.
Doctor, thank you so very much for being with us today.
Pleasure.
This is a really important one to me, so I really appreciate you coming here. And guys, if you know folks who have alcoholism disorders or whatnot, please get them the help that they need. And more importantly, let's not chastise them, okay? Because they do have a problem, they need some help. So thanks very much. Stick around, guys. We'll be right back.